When we breathe, our systolic BP drops. This is because, imagine this is our heart. Okay, let this be our heart. This is right atria, right ventricle, left atria, left ventricle. When blood gets filled to the right atria and to the right ventricle, during inspiration our thoracic cavity expands, right? So venous return increases, so more blood reaches the left ventricle. Because of the increased return to the left ventricles, it starts to bulge this towards the left ventricle. Because of this bulge, left ventricle volume decreases, so left ventricle output decreases. So this is normal physiology. This drop is normally seen as 2 to 6 mm Hg. Now let's talk about pulsus paradox. If this drop is more than 10 mm Hg, it is pulsus paradox. So let's see what is happening in cardiac tamponade. So this is our heart. This is right atria. This is left atria, right ventricle, left ventricle. So what is happening in cardiac tamponade? It's just imagine like there is a belt around the heart which gets tightened breath by breath, hole by hole, just like a belt. So what happens because of this? Because of this, when blood gets filled, our heart can't expand to the outside. So because of this, what happens? The blood builds inside this, it squeezes here, just like we see in pulsus paradox. And because of this pushing of right ventricle to the left ventricle, our stroke volume decreases. Then what happens? BP decreases. Along with now let's see what is Beck's triad. This decrease in BP and increase in JVP, because blood can enter the right ventricle, right, because of the cardiac squeezing, because of the tamponade, and muffled heart sound. Because of the fluid around. This is known as the Beck's triad. Now what is the treatment? Treatment is pericardiocentesis. What do? We drain the fluid, that's equal to removing the belt. So there is another topic you should be aware. It is the electrical alterance. What is this? This is beat to beat voltage variation. Beat to beat voltage variation in ECG. Why it happens? Why? It is because heart swings in fluid. Heart swings in fluid. So summary. Tamponade is a squeezed heart. It beats but can't fill. Blood backs up. GVP rise, BP fall, muffled sounds. Then what? Now let's see the important X-ray findings. Heart will be a water bottle bar, flask shaped heart. Then what? Bedside diagnostic test. Bedside diagnostic test. Echo. You can do fast. Then what? Points to remember, note. What not to be done. You should not give diuretics. What will happen? It decreases preload. Shock worsens. Shock worsens. Imagine there is already no output happening. Then what will happen if you give diuretics? Must not give vasodilators. What happens? It drops BP further. Should we give? Don't give positive pressure ventilations. Why? Decreases venous return. So why positive pressure ventilation should not be done? Pressure. Normally when diaphragm expands and all, the blood is pulled into the heart because of the negative intrathoracic pressure. Blood is pulled into the heart, venous return increases. In positive pressure, we pushes air into the body, so venous return drops. It is like machine pushes air into the body, chest pressure becomes positive. Because of this positive pressure, it compresses the veins, venous return to the heart decreases. Machine pushes air, chest pressure becomes positive. So because of this, veins compress, venous return to heart decreases. Normally what happened? Normally heart pulls blood because of negative chest pressure, because of the diaphragm expansion and negative pressure. Blood is sucked into the heart by the pull of the blood. But this is different. We give a positive pressure, so because of that, chest pressure increases, so it compresses the veins, so venous return decreases.